You just know. Sometimes you feel it in your bones.
Hello and Assalamualaikum. My name is Wan Ida Hamizah, and today I'm going to present to you on the drug discovery of propranolol, where propranolol is being used as antihypertensive and anti-migraine. So, do you know who is the inventor of propranolol? Basically, propranolol was being discovered by a pharmacologist named Sir James Black. This drug actually was created to treat patients with angina pectoris, and this drug development actually marked a significant achievement in drug discovery in the 20th century. Do you know why? Okay, basically this is because of the idea and concept brought by Sir James Black in inventing a drug that will help in treating cardiovascular disease, where instead of developing drugs that increase the oxygen supply to the heart, Sir James Black proposed to have drugs that will lower the oxygen supply to the heart. This ideology is because he thinks by lowering the activity of the heart, less oxygen will be needed and helps to treat patients with cardiovascular disease. Then, journey of propranolol continued in 1960s also, where people discovered propranolol can be used as both antihypertensive and anti-migraine. Okay, basically the discovery of propranolol as antihypertensive drug occurred serendipitously, where this propranolol just able to show low blood pressure in hypertensive patients. And although propranolol use a different mechanism as compared to the other antihypertensive drugs, still propranolol shows better activity in controlling blood pressure. This can be supported when a research found that propranolol holds the function as antihypertensive drug for 40 years. And actually, propranolol used several mechanisms to treat patients with high blood pressure, but then this part will be covered by other members of the group. Now, we will go to the next phase, where propranolol in the late 1960s into the early 1970s, propranolol was discovered as a prophylaxis of migraine. Okay, again, this discovery as a prophylaxis of migraine occurred by chance. And this is because a research found there is a slow reduction in migraine frequencies, and a study further support that 60% to 70% patients with migraine showed improvement upon consumption of propranolol. And this data actually marked that propranolol able to prevent migraine and reduce headache. And further study was conducted by a researcher, and they found that even a low dose of propranolol able to prevent patients from getting migraine. And propranolol continued the discovery in 2002, where during this year, propranolol was announced to be no longer become the first or the primary choice of drug for treating hypertension. Okay, basically this is because during this year there are so many there are new development of antihypertensive drugs, new generations of antihypertensive drugs which replace the role of propranolol as antihypertensive drug. For example, thiazide diuretics, which are able to show better activity in treating cardiovascular disease and in lowering blood pressure. This thiazide diuretics is more to be preferable as compared to this propranolol. Why do we need to have a drug that able to show in both activities? Why this drug has to treat both the cardiovascular disease as well as the high blood pressure? This is simply because a scientist stated that a patient with cardiovascular disease is usually associated with high blood pressure. So this is the main reason why thiazide diuretics and other hypertensive drugs is more preferable as compared to this propranolol. And in the year 2014, 8 guideline in treating hypertension was proposed by joint national committees, where in this guideline, they just emphasize on the use of propranolol as a second-line drugs. So, here is all the journeys of propranolol as using of propranolol on how they being developed and discovered as a drug for treating hypertension and migraine. So that's all from me. Thank you.
Moving on to medicinal chemistry of propranolol. In this case, it interacts with its specific receptor by hydrogen bonding interaction that will cause reversible interaction of the drug with the receptor. Actually, the propranolol is having a similar structure with the adrenaline in which both of the drugs contain ethanolamine in its structure. This is why the propranolol is having the similar ability with the adrenaline in the binding to the beta-adrenergic receptor. However, what makes the propranolol differs from the adrenaline is that it contains aromatic ring, which makes it an antagonist to the noradrenaline as well as the adrenaline. The propranolol structure also contains the oxymethylene bridge. Nevertheless, its presence is only lengthening the chain without giving any significant effect to the structure. Besides, it is vital for the propranolol to contain an aromatic ring and beta-ethanolamine. However, there is some restrictions to the aromatic ring in which only the benzoheterocyclic like indole and heterocyclic like thiazide are proven to be effective. In addition, the branch and secondary substituted R1 group is the most effective one. Nevertheless, the side chain can be variable that can attach directly to the aromatic ring or link it through an acyl amino group. Some of the examples of the side chain should include alkane, alkene, sulfhydryl, or amine group.
I am Munira. So moving on to how propranolol control hypertension. Propranolol is a non-selective beta-adrenergic blocker that will compete with norepinephrine and epinephrine to bind to beta-adrenergic receptor. Once propranolol binds to the receptor, it will block the binding site of norepinephrine and epinephrine. The receptor is within myocardium, bronchial, and vascular smooth muscle. So, how actually propranolol control blood pressure? First, it can bind to beta-1 receptor on the cardiac muscle and delay sinoatrial and atrioventricular node signaling, thus slower heart constriction. The cardiac output will be lower and the blood pressure is reduced. Next, it can bind to beta-2 receptor on the vessel. It can cause vasoconstriction that will lead to increased peripheral vascular resistance, therefore gradual decrease of both systolic and diastolic blood pressure. It also can increase sodium retention, thus reduce water loss and increase blood volume. Therefore, proper blood circulation is promoted. It also can cause bronchoconstriction. Therefore, special attention is needed in chronic obstructive pulmonary disease patient and asthmatic patient. It also can reduce glycogenolysis. Therefore, diabetic patients who take insulin need to monitor their blood glucose regularly.
Hi, I am Shamira Nabila. So, we already looked at the action of propranolol against hypertension. How about migraine? Actually, the mechanism of action of propranolol against migraine is unclear. But some literatures did discuss some of the possible mechanism of action of propranolol against migraine. Now, let's talk about how propranolol works on migraine. The first mechanism is the blockade of beta-adrenergic receptors on blood vessels, specifically the extracranial vessels and also the intracranial vessels. On extracranial vessels, propranolol prevents reactive vasodilation, while on intracranial vessels, propranolol inhibits cerebral glycogenolysis and glycolysis. This will reduce the phosphorylase activity and consequently decrease cerebral oxygen consumption. The overall effect of propranolol on these blood vessels is vasoconstriction. Moving on to the second mechanism of action, propranolol acts by blocking the adherence of sticky elements and platelets in the blood. This will promote the release of specific substances that cause blood vessels to constrict, and again vasoconstriction. This is because vasoconstriction is said to be vital in opposing the pathophysiology of migraine. The third mechanism of action of propranolol is to reduce cortical hyperexcitability. So this picture shows the cerebral cortex consisting of several different lobes. Cortical hyperexcitability is determined by measuring the value of phosphine threshold. Phosphine threshold shows the electrical excitation of our cerebral cortex and subsequently the visual cortex excitability. An increase in the value of phosphine threshold resembles decrease in the value of electrical excitation of cerebral cortex and also the visual cortex excitability. So basically, that's the mechanism of action of propranolol in migraine.
I am Siti Razia, medics number 1612212. So now I would like to explain a little bit about the main clinical indications and therapeutic of propranolol, or we can say Indorol, beside hypertension and migraine. So the first one is angina pectoris. So this angina pectoris occur due to coronary atherosclerosis, which is the blockage of the cholesterol inside the coronary artery. So, the patient that having this angina pectoris, he will be having the temporary chest pain, pressure, or discomfort. So, this propranolol will help in decreasing the angina frequency and increase the tolerance in patient with angina pectoris. So next is atrial fibrillation. So actually, atrial fibrillation is a heart rhythm abnormally caused by a problem with heart's electrical system. So normally the heart's electricity flows from the top, okay, which is the atria, to the bottom chambers, which is ventricles, causing the normal contraction as stated here. But then in atrial fibrillation, the electrical flow is chaotic, so it causes the heartbeat to become irregular. So this is a wave of the atrial fibrillation. Okay, so this propranolol can be indicated to control the ventricular rate in patients with atrial fibrillation and rapid ventricular response. Next is essential tremor. So actually essential tremor can be treated with propranolol, which is essential tremor that is from hereditary, which is a genetic. So this genetic or essential tremor consists of involuntary, rhythmic, oscillatory movement, usually limited to the upper limbs. So it is absent at rest, but occur when the limbs is held in a fixed posture or position against gravity and during active movement. So as we can see in this picture, okay, the patient that having the essential tremor will be having difficulty in doing activities like drinking, eating, getting dressed, and drawing. As you can see, the difference between the individual with essential tremor and individual without a tremor. So this drawing from individual without a tremor, and this one with individual, yeah, with the essential tremor. So we can see the difference between it, and they are having this problem. So this propranolol, also we can call it as Indorol, it causes a reduction in the tremor amplitude but not the tremor frequency. However, for the treatment of the tremor associated with the Parkinsonism, the propranolol cannot be used. Next is pheochromocytoma. Pheochromocytoma is a rare tumor of adrenal gland tissue. It results in the release of too much epinephrine and norepinephrine, which is here you can call it adrenaline, hormones that control the heart rate, metabolism, and blood pressure. So this propranolol can be indicated as a junction to alpha adrenergic blockade in controlling heart pressure and reduce the symptom of catecholamine secreting tumors.
So now let's move on to the adverse drug reaction of propranolol. Propranolol can affect cardiovascular, nervous system, gastrointestinal, dermatologic and sensitivity reaction, and many more. So, how propranolol can affect cardiovascular? Patients with digitally intoxicated may suffer by bradycardia upon taking propranolol. It is sometimes severe and may be accompanied with hypotension and shock. Next, long-term treatment of high dose of propranolol can cause lightheadedness, nausea, dizziness, irritability, and stiffness. Next, the patient may suffer vomiting and diarrhea. On rare occasion, consuming the propranolol may cause rashes, dry scaly on the trunk, extremities, and scalp. For the patient who smoke, plasma propranolol concentration may be decreased because cigarette smoking may induce hepatic metabolism of the drug, increasing propranolol clearance up to 100%. Propranolol should be used with caution in patients with renal or hepatic impairment, as it may increase the side effect of the propranolol. Okay, that's all about the adverse drug reaction of propranolol. Yeah, of course, the adverse drug reaction disappeared after dissolution of the drug.
Walk the streets at night, you're way too short to get on this ride.